Hello, my name is Alexa Kwachak. I'm in Sports Medicine 3 at South Tahoe High School, and for my fifth project, I had the topic of post-surgical rehab, and I decided to do mine on lumbar laminectomies. So, what is a lumbar laminectomy? This surgery is also known as an open decompression surgery of the spine, and it is performed to alleviate and help with issues related to the compressed spinal cord and or nerve roots. And it is the process of the removal of the lamina in the spine, which is the posterior area of the vertebra. And there are two different types of laminectomies. First is bilateral, where both sides of the lamina in the affected vertebrae are removed, and then a unilateral laminectomy, where part of or the entire lamina on one side of the affected vertebra are removed. And so then some non-surgical treatments that are used before looking to surgery include physical therapy, medications, and epidural steroid injections. And generally, individuals will utilize these non-surgical treatments between 8 to 12 weeks. And when there's no improvement shown, that is when you start to look at surgery. And for some reasons for a lumbar laminectomy, spinal stenosis is the most common reason as to why someone would get this surgery, which that is narrowing of the spinal canal, which really affects the spinal cord and nerves in the spine and back area, and herniated discs, as well as tumors, bone diseases, injuries, and aging is actually can cause compression within the spine. So yeah, and then over here on the right is actually images from a surgery. So here is the structure of the spine over here on the left. And as you can see over here on the right, it highlights the lamina area of the spine. And then here is a video regarding this specific surgery, and we'll just go over the basics.
A lumbar laminectomy is typically performed to alleviate pain from lumbar spinal stenosis. Spinal stenosis is caused by degenerative changes that lead to enlargement of the facet joints in the back of the vertebrae. The enlarged joints and related degenerative changes place pressure on the nerve roots as they exit the spine. Each vertebra has two portions of vertebral bone over the nerve roots in the back of the spine. These small flat bones are called the lamina. The lamina functions as a protective covering of the spinal canal. In the lower back, they protect the cauda equina, the nerve roots that branch off of the spinal cord, as well as the nerve roots as they exit the spine. Removing all or part of the lamina through a lumbar laminectomy can give the affected nerve root more space and a better healing environment. In a laminectomy surgery, the spine is approached through a 2 to 5 inch incision in the midline of the lower back. Next, the left and right back muscles, called erector spinae, are dissected off the lamina on both sides and at multiple levels. After the spine is approached, the lamina is removed, allowing visualization of the nerve roots. The facet joints, which are directly over the nerve roots, may then be undercut or trimmed to give the nerve roots more room. After the surgeon has confirmed that all pressure has been removed from the nerve, the paraspinal muscles are sewn back together to cover the laminectomy site. After the lamina and any other sources of pressure on the nerve roots are removed, the nerve roots have room to heal.
Okay, so that is just an overview on the surgery. And next, so The goals of this surgery include relieving neural tissue compression, relieving bowel or bladder problems, as well as improving leg function. And 85% to 90% of spinal stenosis patients find relief from leg pain prior to or after the surgery. And then 75% of patients have satisfactory outcomes for up to 10 years after they have the surgery. And then as for the rehab process, there are 4 different phases. The first phase is the protection phase and focusing on immediate motion. Second is intermediate phase. Third, advanced strengthening phase. And fourth is the returning to activity. For phase 1, protection and immediate motion, this phase is 0 to 6 weeks post-operation. So during 0 to 3 weeks, no physical therapy unless specified by physician, and just a gradual return to daily life activities as needed, but without putting too much pressure on the spine or body. And then a follow-up appointment at 3 weeks to clear for physical therapy. 3 to 6 weeks, walking programs 3 times, 30 minutes a day, light resistance for upper lower body, and just 0 to 5 pounds, nothing too heavy, as well as posture training and spine core stability training, as well as stretching of the cervical spine and an increase in activity tolerance. And a few things to think about include managing pain and swelling, monitoring wounds for breakdown or infection, avoiding excessive lumbar flexion and extension. That is a super important one with this surgery, especially during this first phase, and as well as performing soft tissue mobility when necessary. The next phase is the intermediate phase. This is 6 weeks to 12 post-operation. So this is when the client will begin non-impact cardiovascular activities with a neutral spine, still being pretty careful about too much excessive lumbar flexion and extension. And then neural glides mobilizations, which is stretching, as you can see in the middle picture below. As well as aquatic physical therapy, which is pretty great. It doesn't put too much pressure, and it's just a great resource for patients to use post-operation. And then, so you still want to be taking these things into consideration during this phase as well. For phase 3, advanced strengthening, 12 to 16 weeks post-op. For weeks 12 through 15, continuing with non-impact cardiovascular activities, progressing with strength, initiating sagittal plane core stability training, and continuing with soft tissue mobility and joint mobilizations on spinal segments. However, only on the spinal segments, not 2 segments. They have to be at least 2 segments away from the vertebrae that were performed on. And then at 16 weeks, cardio equipment as tolerated, so progressing slowly to straight line jogging, introducing core training in transverse and frontal planes, progressing to all 3, and unrestricted upper and lower body strengthening. And during this week, you also initiate plyometric programs, which is jumping. And then phase 4, returning to activity. And this is generally 16 to 24 weeks post-op. It can differ from patient to patient, but this is the general protocol. So continuing with strength and flexibility programs and exercises, interval sport program with gradual turn to sports and activities, and then the return to play criteria includes satisfactory range of motion and strength, satisfactory completion of interval sport program, and a clinical exam and physician approval. And these are the sources that I used. Thank you so much for watching. Let me know if you have any questions.